Hi everybody. Today we're going to talk about the basics of Medicare. Medicare has four parts, A, B, C, and D. Only parts A and B though are actually administered by the government. Anything else, Part C, Part D, a Medicare Supplement Plan F, G, N, A, all those things are administered by private insurance companies. So when you get your Medicare card, it only has Medicare A and B on it. What is Medicare Part A? Medicare Part A is hospitalization coverage. So think of the A as in admission to a hospital. Inpatient coverage, if you have home health care, if you have hospice care or skilled nursing, which would be like going to a rehabilitation hospital after a regular hospital stay. Those are covered under Medicare Part A. Medicare Part A has a $1,288 deductible for a 60-day benefit period. So anything else after that $1,288, which will be your responsibility, will be picked up and paid for by Medicare. Now, if you're still in the hospital for one long continuous stay longer than 60 days, which is rare, but it does happen, then you're now going to incur a daily copay of over $300 a day. And if you're in for over 90 days, you're going to pick up double that. You're going to have double that amount. But for the vast majority of hospital visits, you're just going to have the $1,288. However, that deductible is not annual. So if you get released from a hospital after a few days, you get that bill for $1,288, you pay it. More than 60 days goes by, and then you get admitted to a hospital again within the same calendar year, you're going to have to pay that $1,288 deductible again. So that is Medicare Part A. Medicare Part B. That's also in your Medicare card, and that is medical insurance. That's going to cover doctor visits, labs, CAT scans, CT scans, x-rays, durable medical equipment such as wheelchairs, walkers, scooters, things like that. And if you had something like chemotherapy, day surgery, day procedures, those are all covered under Medicare Part B. Medicare Part B covers 80% of those charges after an annual deductible of $166. And as you can see that Medicare Part B is also on your card. So Medicare A and B are considered original Medicare. If you're currently drawing Social Security, they generally will send you your Medicare card with A and B on it about 3 months before your 65th birthday, which is when most people are eligible. If you're still working and have creditable coverage and you don't need Part B because there's a cost to Part B, then they're going to send that back. You can send the card back to them and request that they take off Part B and you only have Part A for now, because if you have if you're part of an employer group of more than 20 employees, Medicare is usually going to be secondary. Always check with your group administrator first though, just to make sure that that's the case. Medicare Part A has no cost to it. Medicare Part B does. And for most people, it's $121.80 per month. If you are drawing Social Security, they'll take it out of your Social Security check. If not, they'll send you an invoice. You can generally pay it quarterly, or you can set up an automated payment monthly out of your bank account. Medicare Part A does not have a cost because you've already paid into the Medicare system. So for the vast majority of people, there's no cost for Part A. Okay, so now we get into Medicare Part C. Medicare Part C is called Medicare Advantage and is not administered by the government. Medicare Part C is administered by private insurance companies. If you enroll into Medicare Part C, first of all, you must have Medicare A and B. You must continue to pay your Part B premium. But Part C, when you do enroll in that, you're basically choosing now to get your health benefits from a specific insurance plan, whatever company that is. That means that you're now part of a doctor network, and every company has different doctor networks. So your doctor may or may not take your Medicare plan, and it's really important obviously to know that ahead of time. A lot of the plans are HMO plans. Some of them are PPO plans. Most of the HMO plans now require that you get a referral to see a specialist. And on the PPO plans, generally speaking, it still does cost a lot more to go out of network. So you really have to understand those costs. Most of these plans have copays for just about everything now, except some of them some of them don't have a copay for seeing a primary care physician, and some of them do. There's generally more choices in a more populated urban area than there are in rural areas. The premiums on these plans, the attraction of these plans for a lot of people are lower premiums than Medicare supplements, or sometimes even zero premium. A lot of these plans include prescription coverage, which is what they call an MAPD plan. So if you do get one of these plans, you will not have coverage on an HMO plan if you go outside a network unless it's an emergency. So that's an important distinction to know. You need to understand the maximum potential out-of-pocket costs, what the copays are, how the network works, how do you get, or can you get benefits if you go out of network? In other words, is it a PPO plan or not? All these things are what you are getting into if you buy a Medicare Advantage plan. So understand that. Medicare Part D is prescription drug coverage. When you get a Medicare Part D plan, a lot of my customers, they have original Medicare A and B. They choose to perhaps buy a supplement to help pay for that Part A and B deductible and that 20% that Part B doesn't cover. But then they need prescription coverage as well. That's what a Part D plan is, a standalone PDP or prescription drug plan. There are, in Texas, 26 different plans available. So in another video, we're going to talk about how do you zero in on the right one. These plans are all administered by private insurance companies. Even though Medicare, it's Medicare Part D, you get it from an insurance company. Each company can have a different list of prescription drugs that are covered. That's called their formulary. They can have different copays. One prescription may be what's called a tier 1, and one may be a tier 2 on another plan. You could have one that has a low copay on one and a higher copay on another. You really just need to find out, and the decision for which plan to get really should come down to what medicines you're currently taking. It's important to note that if you do have a standalone Part D plan, you cannot have Part C and D together. You can only have one or the other. Having Part D means you're still on original Medicare, and your original Medicare A and B benefits will kick in or cover you medically. But if you have Part C, you're getting your health plan from an insurance company. A lot of the Part C plans include drug coverage, but if you get one that does not, you cannot separately get a Part D plan. So they're mutually exclusive. It's one or the other. So that's Medicare Part D. If you don't have creditable coverage when you turn 65, you have only a short period of time to enroll into a Part D plan. If you don't get one when you're first eligible, and then you get one later, there's a permanent late enrollment penalty that you need to know about. We'll cover all that in enrollment deadlines in another video, but for today, that's what Medicare A and B are. That's original Medicare, and then Medicare Part C and D. So thank you very much for watching, and we'll see you on the next video.